the benefits of the fast in relation with the weight loss mainly. But in today's webinar, I will try to reflect upon and share with you some emerging evidence on fasting as cancer treatment, whether we call it a myth or a breakthrough in oncology. Let's see in coming slides. So as we are now walking through, this concept as fasting as a potential strategy, it means it's not conclusive. Potential means it has promising future in the direction of treatment of or as a part of treatment of anti-cancer therapy. Definitely, you know about the metabolism. Cancer, diseases like cancers, hypermetabolic conditions do affect the metabolic route, and it bypasses the normal route for glucose metabolism, protein metabolism, and fat metabolism. And the current evidence supports its role mainly as a complementary therapy, like adjunct. We also call it adjunct therapy. It's not primary. You can see it's not a primary therapy that can change the fortune of cancer patients. However, with the cancer therapy, other therapies, chemotherapy, radiotherapy, it has effects. We have seen, and the paper published in the journals like Nature about autophagy, I will share in slides, where they reflect upon that the fast, every hour of the controlled fast is a step forward, strengthening resilience against cancers. It has both direction from resistance against the toxicity of the cancer treatment, both ways. It's like a two-edged sword. Cancer therapy, which includes surgical therapy, radiotherapy, radiation therapy, or chemotherapy, it is very toxic. All the therapies are cytotoxic, hepatotoxic, nephrotoxic. So fasting, as per we have this preclinical data from animals that is proving some association that it will minimize those toxic side effects of cancer therapy. On the other side, it can improve the effect of therapy, chemotherapy, in positive direction, in killing or damaging, like DNA damage will increase. How it will increase the sensitivity? By damaging the cancer cells and the DNA of those cells. So in one way, it will decrease the chemotherapy or the radiotherapy toxicity effects. On the other side, it will improve. According to the latest, it might improve, according to the latest evidence, it might improve the efficacy of chemo and radiotherapy against cancer cells. So we have this big challenge of cancers, and there are a lot of therapies we are talking about in the past many decades. So it's a good time that we have a new idea while Ramadan month is celebrated in the Muslim world. So why not to take and talk about the benefits of fasting with relevance to cancer and cancer therapy. So that is the main objective of today's webinar, and my talk is mainly for scientific professionals, and there are good news for cancer patients for future. Like I cannot talk about all these the points that I am now showing you on the slides, but mainly I want to focus on autophagy, role of autophagy. Autophagy, if you read more about this, recently in 2019, if I'm not wrong, the Nobel Prize winner from Japan, the scientist from Japan, he won this prize because of the sharing the evidence about autophagy, fasting and autophagy, and then its effects, positive effects on dead cells. Dead cells are dead mitochondria within the cells or other organelles which are weak, which are dismembered. So the cells, when they are experiencing starvation or fasting, structured fasting, regular with a regular period of time, the cell starts eating its weak and sick organelles within itself, like mitochondria, like other diseased, particles within the cells. This is called autophagy. And with, the process of autophagy, it helped the scientists to win the Nobel Prize. Now we are having a lot of hopes that the role of autophagy, it not only protects the normal cells, but at the same time, it increases the immune system and it increases the resilience in the normal cells. It actually, at the end of the time, at the end of some period of fast, it actually rejuvenates and resynthesizes the cell structures, the cell functions, and the cell formulations. It appears in the study that after the fast time period, with the help of autophagy, the cells actually, they regenerate, they regrow, and there is a process of rejuvenation. And if there are cells which are gonna be, or they have a potential to become cancerous in coming future, those cells are being eaten by inside the system after autophagy, with the help of autophagy. So in that direction, what we are now hoping that it can prevent, or it has a potential role in various types of cancer preventions. Then Warburg effect, this has an impact on cancer cell metabolism. Like fasting will reduce the glucose and IGF-1 levels, potentially limiting tumor growth and improving treatment response. The cells, all the cells, they need glucose to grow, to multiply. The mitotic cell division, or any kind of cell division, or any kind of cell regeneration or synthesis, it needs glucose, it needs a substrate, it needs nitrogen. So with the fast, the impact of fasting is is promoting gluconeogenesis, like the stores of glucose in the form of glycogen, then liver, they are exhausted, and it will reduce those reserves, and definitely the cancer cells will be deprived of that required energy, that will stop their progression by this way. Now, quickly, I will go through this stress resistance in the normal cells and enhancing chemotherapy. I already told you about this, that in one way it improves chemotherapy effect against cancer, and the other benefit is it reduces the cytotoxic effects of chemotherapy. Fast is two-edged sword in cancer patients when there is a cancer. As I told you, it's animal studies, in vitro studies, preclinical models suggest fasting may reduce tumor growth and enhance treatment response, but consistent clinical benefits in humans remain unproven. So there is more to be, researched and extrapolated about cancer. Tumor growth reduction, as I told you, it restricts tumor glucose supply, disrupts cancer metabolism, and may enhance chemotherapy while protecting normal cells. I will take you to, I think, this slide, the potential benefits. Fasting induces a stress-resistant state in normal cells and reducing chemotherapy toxicity, as we discussed before, I think. Reducing the side effects, and then induces autophagy. Fasting triggers cellular recycling mechanism that clear damaged organelles and proteins, including dysfunctional mitochondria and cancer cells. Again, I told you about this in the beginning. It modifies the tumor metabolism, and cancer cells depend on glucose for survival. Fasting deprives them of glucose, disrupting their metabolic pathways. And this last point, boost immune response. Animal studies like rodent studies show increased activity of natural killer NK cells and cytotoxic T cells during fasting. So it has a positive effects on the immune system, or it improves or boosts the immunity in the animal studies. So hope this has the same effect in animal study, but in human study, but still we are waiting for those studies. So we can say, to summarize, fasting reduces metabolic stress in cancer cells, enhances chemotherapy, radiotherapy efficacy while sparing normal cells. And this one also I think we discuss. Here, the challenges, we must not forget that when we are talking about fast and the benefits of fast, there are some limitations. For example, patient with cancers, they always they are experiencing weight loss, muscle loss. So there is malnutrition risk. Cancer patients often experience cachexia and severe weight loss. So fasting may exacerbate this condition. Secondly, the data is limited. Human data is limited. Most evidence comes from preclinical animal studies and small-scale human trials. So we are running short of the human data. Mostly it's coming from the animal studies. And it's not a stand-alone therapy. Fasting alone is unlikely. Like, as I said, there is a chemotherapy, radiotherapy, and with that, if we use fasting as an adjunct therapy, as a complementary therapy, then fasting may have a supportive role. But fasting alone is unlikely to induce tumor remission. Tumor remission means patient treatment is successful and patient disease is reversed. Still treatment is on, but patient is now in remission state, means patient treatment is working and patient is now on the way towards the success in the treatment. It may only complement conventional treatments like chemotherapy and radiotherapy. And potential adverse effects. Extended fast, if the fast is prolonged for a longer period of time, it could lead to electrolyte imbalance, hypoglycemia, and weakened immunity. So these challenges and limitations should also be taken into consideration. It is not a stand-alone therapy. It may work as an adjunct therapy or a complementary therapy. So the recommendation until now, the limited clinical data with some limitations, animal studies are more and more being shared, and we are extracting those data, and conclusion is not, the results are not inconclusive. So what we should do to really, prove some causal links between fast and the cancer and the cancer therapeutic effects. Clinical trials, we need more clinical trials, large clinical trials, RCT, randomized clinical trials, to validate fasting is safe and efficacious as a complementary therapy. And this could provide robust evidence to support the use of fasting in oncology. So it is a must. Without this, we would say the evidence is limited and it is not conclusive. It is inconclusive. We need more personalized approaches. Fasting regimens may need to be tailored individually, tailored to the individual needs and profiles, including cancer type, stage, overall health. The cancer there are 200-300 types of cancers. There are liquid tumors, there are solid tumors, there are blood cancer, there are head and neck cancers, breast cancers. Each and every organ has some types of cancer. So we are not sure fast has an effect, but which one, who is who, where it affects and where it affects are not proven, and sometimes it might go in other way. It might go wrong. So precision oncology could integrate fasting as a part of multidisciplinary approach to treatment if it is proven. Combination strategies, as I said, it has a adjunct effect. So exploring fasting in combination with immunotherapies, targeted therapies, or fasting mimicking diets. So we can say that there is promising evidence, emerging evidence, fast as adjunct therapy to the cancers, with the limitation that the studies which indicate towards the positive effects of fasting on cancer treatment, they are actually mostly animal data. So we need to increase human trials and gather more human data to validate the use of cancer, to use of fasting as adjunct therapy for the treatment of patients with cancer. I think I would not take more time on this. If you have any questions now or later on, I will be available for any type of questions. Thank you very much once again. Over to you.